Welcome to day 4. Today we're going to talk about directional terminology. And so the textbook pages that you're going to need to be referring to are page 15. There's a chart on page 15. And then also on page 18, there are a description of the body planes. So the very first thing that I want to talk about is the concept of anatomical position. Anatomical position is really important in anatomy and physiology because we need to have the same frame of reference. So, for instance, I'm waving my which hand? This is actually my right hand, and this is my left hand. So think about if you're a surgeon and you're going to operate on somebody and they're supposedly having something done to their left leg or their right leg, and you're just like, which leg is that? Is it the leg that I'm looking down at or whatever? So I want you to stand up and I want you to um, assume anatomical position. And you can see that on the figure on the person that is on the screen on our PowerPoint. What it is, I'm going to stand up and then it's not going to show you my whole body, but it's standing with your hands facing out. So your thumbs should be facing this way. That's really important because your arm has bones that cross over each other. So if you're going this way, the bone actually crosses across. And if you're going this way, then they're running parallel. So correct anatomical position is standing up straight with your thumbs facing outward. So that's our first learning target that I want you to look at. Then what we're going to do is go through quickly and discuss the things that are on that chart on page 15. So the first one is the word superior. Superior means towards the head or the upper part or structure of the body. So my head is superior to my chest. So towards the top. The forehead is superior to the nose. So that is the term superior. The next one, this thing isn't working, of course. Um, there we go. The next one is the opposite of superior, and that is inferior. So away from the head or towards the lower part of the body. So just the opposite. The chest is inferior to the head. So you're always comparing two things with each other. The navel is inferior to the breastbone, it's below it. So that's inferior. Then we have directional terms that are describing the front and the back of the body. So ventral typically means a four-legged creature would be the description. So if you are a dog, your belly is ventral. For humans and things that are upright, we call that anterior. So anterior is towards the front. So anterior versus ventral, they both describe this area, but a four-legged creature, the proper term would be ventral, and a person on two legs, it would be anterior. Um, Posterior is the opposite, and again, in animals, we would call that dorsal. So the back side is dorsal, and the front side is ventral on a four-legged creature. On a two-legged creature, it's anterior and posterior. Medial, think of middle. So medial towards the midline. So the heart, and again, we're always comparing one structure to another. You can't just say that's medial because it's medial to what? You have to have a comparison. So the heart is medial to the arm. It's towards the middle as compared to the arm. Lateral is the opposite of that. So lateral is away from the body. So your arms are lateral to your chest. So your chest is more medial and your arm is more lateral. Intermediate means between. So between something that's more medial and more lateral. So your collarbone, which is right here, is intermediate to the breastbone, which is where you would look to do CPR, and your shoulder. So it's in the middle. So collarbone is 1, breastbone is 2, shoulder is 3. So you can use that to describe the placement. Proximal, proximity, close to the origin of the body part or point of attachment to the limb of the body. I want to talk about the origin. Origin means where it's attached. Insertion means where the muscle goes after that. So your bicep is attached here. This is the origin. The insertion is on your elbow side because when you contract, that muscle is pulling. And so proximal means close to the origin. So if you think about, um, let's say your hand versus your elbow is proximate to your wrist because it's closer to where it's attached. Distal is the opposite. So these terms are referring to the arms or legs because they're looking at the appendages being closer to the attachment. So you can't say something on your body, on your trunk, because it's attached to what? So proximal and distal, we're both talking about appendages. So distal is the opposite again. So when we look at the example here, the knee is distal to the thigh. It's further away from your groin where your leg is attached. So if we did that with our arm, the the wrist is distal to the elbow. Superficial, the two words that are going to contrast each other there are superficial and deep. Superficial means on the body surface, so a freckle would be superficial. Deep means internal, it means inside. So the example here, your lungs are deep to the rib cage, they're inside. Whereas the rib cage is more superficial, it's outside surrounding it. So that is the end of what we are doing today. Um, we will have an assignment, or you do have an assignment posted, which is to do your study guide, questions 56 through 68. This weekend, I will be putting together a Quizlet for you for directional terms and some of the other things for practice. And we will do another activity to apply the directional terms. And then we're going to go in and do the anatomical terms, which are um, on page 16, where we're talking about the body landmark. So what we call the placement, which we did a little bit on that intro activity. So that's what you can look forward to. I hope you have a really nice weekend. Get outside on Sunday. It's going to rain on Saturday, so at least that's what they tell me. I'm not no meteorologist, but have a super day. Thank you.